読み直しているで読み直しているだけがで読み直しているで読み直しているで読み直しているで読み直しているで読み直しているでキスしたい人で読み直しているで読み直しているだけがで読み直しているで読み直している
Good morning. Welcome to 1 Million Cups. We do not have a random act of art today. We did try to get Billy Ray Cyrus because in 1992, on this day, he released Achy Breaky Heart. We'll do karaoke after the presentation, but you might not know this. Billy Ray Cyrus is a huge fan of Evan and Janya because he used the pumpkin gutter that they developed on the Today Show. So Billy Ray Cyrus is a huge fan of 1 Million Cups, and he sends his apologies for not being here. Alrighty, so let's get started. Eventually. Point this way. Can you tell I've never done this before? All right. Okay, as long as it's not just me. All right. So my husband is in the tech booth, and I was like, what are you going to do to me? And he's like, nothing, liar. All right, welcome to 1MC. If you are new today, can you raise your hand? One? Well, we're not going to make you come up and feel embarrassed. But what is 1 Million Cups? Well, you'll find out in a minute. Special thanks to everybody who sponsors 1 Million Cups. These are the organizations and the people that are making sure that the doors are open, the lights are on, the clickers are working, and the cups are full of coffee. So if you work at one of these locations or you know somebody who does, tell them thank you. Well, all right, I'm just going to hand this off because I cannot be trusted. Ooh, batteries. Did they come out of your backpack? They did. He carries a stash with him everywhere. It was really weird. We get pulled over in every airport line because you're like, why do you have a backpack full of batteries? Yeah. He has not been arrested to my knowledge for his battery stash. So, oops, we're going to skip what 1 Million Cups is. Oh, it's back. All right, well, hey, it works. Okay, so 1 Million Cups is a weekly event that happens here, and it is a way for our community to connect with entrepreneurs and organizations and to kind of see what's going on in Bismarck Mandan, and it gives the community a chance to ask questions, give feedback, and things like that. Oh, it worked. And the big question, the big takeaway is, can we change the face of our startup community over 1 million cups of coffee? And I myself am really working on getting to that million number, but I need your help. Ooh, big square. Wait a minute. Yep. Okay. You guys are seeing all the slides. We will have a Q&A for our presenters at the end. If you are online, you can tweet, you can comment on Facebook, and someone will ask for you. If you are in person, we'll send around this big mug, and you can ask your question that way. And we are going to be starting something new, a live job board. So the first of every month, we will post about job openings in our community. If you have one you would like to be up on the big screen, just send it in, and we will get it up there. And I know we have a handful of community announcements today, but if you don't have a slide and you do have an announcement, feel free to come up. Is Ellen here? Oh, you'll do it. All right.
I don't think Ellen's here. All right, so I'll play Ellen. So, Business Pitch Challenge in Mandan. The final presentations are today. 5:30 to 8 at Baymont. We've got the 4 finalists there, Bubbles and Brews, Cornhole Cave, Saf Power, and the So Connection. There will be some voting for People's Choice Award. I went to this last year. It was really, really awesome, and I know you guys all like to support entrepreneurs because that's why you're here. So I would really highly recommend you check this out. There was a registration, cityofmandan.com/register. I think they'd like you to do that, but if you don't, I'd say if you showed up, they'd probably let you in. Is that probably fair? So
there isn't a bouncer at the door. And I believe that these companies are going to be at 1 Million Cups next week. Is that correct? So if you come today and you see their pitches, you'll get to ask them questions on stage next week. Whoop, all right. Take it away.
Okay, we had 2 people hit milestones today, 10. So they know who they are. Please come on down. They had a chance to pick their beanie colors ahead of time. So please come on down and join me in front of the stage.
And if you don't know what this is all about, if you bring your orange mug, can you raise your orange mug up? If you bring your orange mug, you'll get a sticker on it every time you come. You can redeem those stickers for prizes, and it's just a cool way to keep the community going and to make sure that we're not throwing away a bunch of disposable paper cups. All right, so getting to today's presenter, you might recognize one of them from end of last year. We have Jake Kubik and Devin Reinbold. They are both with the Sanford Health Foundation. They're going to come up here. They're going to tell you a little bit about themselves and what they do. And they're going to come up here. They're here. All right. So we'll let you guys tell us a little bit about what you do, and at the very end, we'll have time for questions. Good luck with the clicker.
Oh, I'm clicking.
Jake's got the clicker.
Yeah. Well, good morning, everybody. My name's Jake. This is Devin. Thank you for the opportunity to come spread some awareness about what the Sanford Health Foundation does in our community. We're not necessarily a startup, but Sanford Health is an innovator in the healthcare industry, and we're going to share a little bit about what that looks like. So who we are. So the foundation supports the mission of Sanford Health. So I'd like to say we're the strong arm, we're the foundation. That's why a foundation is called the foundation. We provide a blanket of stability for the organization. Sanford Health would not be Sanford Health if it wasn't for the generosity of our donors. The innovation, maybe even going as far as coming to Bismarck, may not have happened if it wasn't through philanthropic efforts. This is our team. Sarah, she's in the crowd. She is our executive director. There's me, Devin, and then Jenna is really the most important person on our team. I don't know if she's here, but she's the person who does everything on the back end to make sure the rest of us goofs can do what we do best out in the community.
So we as a foundation, we're on a mission to improve the human condition by inspiring human connection and philanthropy to power Sanford's work of health, healing, and comfort. One of the proudest things that I can say about us as a foundation is that 100% of every dollar that's donated to us goes directly to support the donor's intent. So whether it's a $100,000 major gift, $50 gift to an event like Gabber, or a nurse donating $1 per paycheck to support her unit that she's on, 100% of every one of those pennies goes to support what that donor wants it to go to.
So we have 5 main centers of excellence in our footprint here. So we have a women's center, heart, children's, orthopedics, and sports medicine, and then cancer. And I want to share one of our patient stories. So this is Scott and his family. They were on a Disney cruise trip, and they were out snorkeling, and Scott, the dad on the right here, started to have some chest problems. And he had to have a lifeguard come out, and they brought him onto the ship and evaluated that he was having a heart attack and he needed to have surgery. This was just off the coast in Florida, and the nearest hospital was in, well, it was Miami. And he's been seeing cardiologists here in Bismarck for some time, and they determined that he needed bypass surgery, and he was really struggling. And he told the folks at the hospital that he wanted to come to Sanford Bismarck because Dr. Russell here in town, one of our cardiac surgeons, has been working with him. And he was able to get a flight from Florida up to Bismarck to have Dr. Russell operate on him, saving his life. And so, although maybe I wouldn't advise that, but that speaks to the trust that our patients have in our medical teams in our Bismarck footprint.
So one of my biggest responsibilities as a development officer at the Sanford Health Foundation is coordinating events. So if that's working with different organizations in the community for sponsorships, working with the marketing team to develop websites and email communication for the events, to making sure there's enough ranch next to the buffalo wings at our golf tournament. Really all event things encompassing.
Oh, come on, that's good.
So I'm excited to share our events that we have this summer. Coming up on June 21st, we have the Blue Way Invitational, a enhanced golf tournament out at Hawk Tree. With that event, we really wanted to create a golf tournament that's different than any other golf tournament here in Bismarck. So from the moment you step out of your car to when you leave, we hope to enhance every experience part of it. We have the Great American Bike Race, which I'll touch on a little bit more after the next two. We have the Cowgirls for a Cure, a barrel racing event out at Beard Arena in Minokin. We have ladies from all across the state and some from other states come to barrel race to support money for breast cancer care here at Bismarck Edith Sanford Breast Center. We also have our Go Hawaiian for Hospice luau style lunch to support Bismarck Hospice. And then back to Gabber. It's our first event that we're going to be hosting this summer, coming up on April 30th at the Bismarck Event Center. Just a little background and history on it. Back in 1997, Dr. Kevin Murphy, 26 years ago, started the Great American Bike Race, known as Gabber in our community. It started with 5 to 10 bikers at the Gateway Mall and has now grown to an event that's going to be at the Bismarck Event Center, which is pretty cool, with hopefully as many teams as we can get. In a typical year, Gabber has around 100 teams made up of 12 participants that come together and bike as much as they can for 20 minutes at a time. But before the big race day, they're out in the community fundraising and raising as much money as they can to help support kids with cerebral palsy and other related conditions that permanently affect their development. So all of the money that's raised from Gabber goes to support these kids to purchase things not covered by insurance. So equipment like wheelchairs, custom orthotics, adaptive tricycles, home and vehicle modifications to make the van wheelchair accessible or to put a stair lift. So all of these things that these kids need are super expensive. So these families turn to the Great American Bike Race to receive assistance in that funding. Now the past 2 years we've had to go virtual with the event due to COVID. And unfortunately with that we've seen a decrease in the participation and amount raised. So we're extremely excited to be back in person this year. Registration is open now. We want to bring Gabber back to what it used to be, get more money coming in to support these kids, because at the end of the day, just because they have a limitation doesn't mean they're any different than any other kid. And these are equipment that they need, and Gabber helps purchase those. So if any of you would like to participate in Gabber, registration is open. You can come talk to Jake and I afterwards, gabber.sanfordhealth.org. You can register your team.
How many people, show of hands, have heard of Gabber prior to today? So,
Awesome.
long-standing event. People know about it, and it's important. So a little bit about how our funds are managed. So step one, the donors give generously to the foundation. 2, we manage that. There's kind of 2 different ways. We invest the funds for kind of perpetual support forever, or spend what are called spendable funds, where a donor might say that I want this $1,000 or $10,000 to go to a specific need that is today, and then we'll use those funds immediately. All of our funds that we manage, our Sanford leaders determine, our executive directors and our managers across our different departments. As needs arise, whether that's equipment or programs, they're able to speak to us and learn about what funds are available to support their initiatives, and then are able to apply for funding for their different areas. And then again, 100% of every dollar that's given to the foundation goes to the area that it's intended to support.
Okay, did we miss a video?
Nope,
No, okay.
it's all you.
Okay, so 2020 impact, our 2021 numbers are just about to be released, but we thought we'd share our 2020 impact. At the foundation, we have the money coming in, and we think it's important to share the impact of what those dollars truly do. So in 2020, over 27,000 heart patients were able to receive expert care. Around 12,500 women received 3D mammography screenings. 967 kids got to experience our Child Life Team, which is a program that's 100% funded through philanthropy. And a little over 200 financial grants were approved for local families here in our community.
Next, we have a little brand video to share with you. I'll get out of the way.
We as an organization provide exceptional care every single day, but philanthropy serves as a catalyst. It allows us to do more. When dollars are given to the foundation, 100% of every gift that's given is directed back to the patients, the programs, and the care that we provide. Nurse navigation is fueled by philanthropy. It's new equipment and new life-saving devices and programs like Child Life Specialists. It allows the cartoon character blankets, and it allows the toys that are tailored to each child. It's meal vouchers, and it's a stay in a hotel that's funded through philanthropy. It's something that so many of our donors believe in because it really does elevate the level of care that our patients and their families receive at Sanford Health. Every single patient at Sanford is impacted by philanthropy.
That first appointment was very much a blur to me because I was in shock. I just couldn't believe it. My name is Michelle Wrighton, and I'm from Fargo. And I first came to Roger Maris because of a diagnosis of acute myeloid leukemia. It's very difficult to treat. It's treated mainly with a course of chemotherapy, followed on by a stem cell transplant or bone marrow transplant. You think about your family and all of the things that you may miss. Well, Mary was my nurse navigator, and she was there from day one, following me until today. She took the time to slow things down and go in more detail to explain what AML was, how it was going to affect me, some of the things to look forward to and things not to look forward to. She's been a big part of my life. So when you walk through the doors at Roger Maris, you feel like you're there for a very specific reason. About 2 weeks after my first bone marrow biopsy, I was admitted up to 7 South in the hospital here in Fargo, and I received chemotherapy treatment. The staff on 7 South are amazing, and I felt so privileged because they're so dedicated to a cancer patient and cancer care that it really makes a difference when you're staying there for so long. By about my 3rd week, I started losing my hair, and they were so kind and considerate. I said, I think I would rather have this in my control instead of cancer trying to control me. The type of stem cell transplant and bone marrow transplant isn't available in Fargo, so you have no choice but to travel. And Minneapolis is the closest that we have for bone marrow transplant. I was in Minnesota from November 1st until March 6th. I really wish that a program like that would have been in Fargo. My entire family would have felt a lot more comfortable if I was just right here, closer to home. This is home. I am so thankful for Roger Maris. My oncologist, Dr. Gross, is top-notch. He is the best. I can't imagine anybody else taking care of me. I completely and totally trust my life in his hands. I think that one thing that cancer has opened my eyes to is I am more grateful and thankful for every day. I sometimes, as strange as it sounds, feel that cancer was a blessing. There's many reasons why that is the case. I value every single day that I wake up. I value my family and I value my friends. I value the most little things in life and don't take them for granted anymore because you just never know what the future brings. So I know firsthand where all the funds go, to know that that facility is funded by so many generous donors. That's what makes it special, because everybody owns a piece of Roger Maris. And at some point in time, somebody will have a relative or a friend or somebody that they know that has cancer. And their donation goes a long way.
%100% of every cent that's given to this foundation goes back to improve the lives of our patients, their families, and the communities that we serve. Philanthropy and the fingerprint of philanthropy is on everything we do. We have donors that give $1 a pay period, and we have donors that invest millions of dollars philanthropically. We don't look at it as a dollar donation. We look at it as a pool of philanthropic dollars that allow us to truly elevate the care that we're able to provide at Sanford Health. You pool that together and it has huge impact. The need for healthcare will never change, but the ways that it's delivered certainly will. When health means everything, the idea of creating a brighter, healthier future together, it can only make you smile and feel good. It's extraordinary what philanthropy can do. Every single gift matters. Every gift matters.
So powerful stuff. Michelle's story isn't unique. 1 out of every 3 people get cancer. And it just kind of depends on what services you have wherever you live and what's available to you, and determines what kind of treatment you're going to get. Ellen here is a little girl who was receiving cancer treatment here in Bismarck, and our Child Life team was able to throw her a Frozen-themed birthday party. And that's kind of the gift that Child Life gives to us here in Bismarck. Their whole program is funded through philanthropic dollars. And their dedication is to take care of kids and their families when they're navigating kind of the nuances and the scariness that can be inside of a hospital, whether that's a surgical room, whether that's just a patient room. A lot of different people come your way. They act as advocates, and that's all they do, is support those kids and their families when they're inside of our medical center.
So none of this wouldn't be possible if it wasn't for what we call our champions. We have so many people in our community that support us and the work of Sanford Health and help make a difference, whether that's our Sanford family, local businesses with sponsorships, or community members, people who receive care at Sanford and are moved by the level of care that they received, or a family member, and become a grateful patient or a grateful family. And make a gift in honor of a physician or a surgeon, or maybe a family or a loved one, in honor of them.
Another patient story here. So Dr. De Silva on the left is a physician at Sanford Health, and his wife, Karen, donated a kidney so that her son, Tony, could receive a kidney. So this was happening, if you can just kind of bear with the anxiety of this situation. So it's March 2020, things are shutting down in the pandemic, and a kidney becomes, so Tony's in renal failure. So they identified that one of his kidneys is shutting down, and he's on a limited timeline now, and he's placed on a transplant list. They identify a kidney in New York City. Airports are shutting down, whole states are shutting down, and as airports are shutting down, this kidney, this donor, this wonderful donor in New York, was able to get into a medical center there, have the kidney removed, and then have it out on one of the last planes out of New York City before they shut down the airports. Got it to Tony. They were at a medical facility in Minnesota, and the reason they were able to get it to Tony is because he was moved up on the transplant list because his mom, Karen, donated one of her kidneys to someone else. So they didn't swap. She didn't give a kidney to her son. She gave it to a total stranger somewhere else. I think it was Nebraska or Illinois. But in order to do that, she saved her son's life and moved him up on that transplant list. And the timing of it was just incredible. And the fact that they were able to get that kidney out of New York and into him with the midst of everything going on with the beginning of the pandemic was just truly amazing. And he continues to receive his care here in Sanford Bismarck. Then we have one more fantastic video for you.
The global pandemic has propelled us into a new future, connecting our world virtually. And for healthcare, the time is now to keep moving forward, bridging the distance between patients and providers, no matter how far apart we are. At Sanford Health, that dream is possible, so that every patient can access world-class care no matter where they live. It starts with a state-of-the-art virtual care center in Sioux Falls. This center doesn't house patients. It houses doctors, nurses, and specialists, providing care virtually to whoever needs it, right where they are. The center is open 24 hours a day, 7 days a week. From here, physicians can diagnose and treat patients, along with seeing vitals, test results, and more. For patients, it means faster, more convenient care. And for Sanford, it means expanding our network of care delivery. From here, providers will be connected to nearly 300 rural clinics across the Midwest, establishing permanent hometown care for patients who've been underserved or inconvenienced. Each of these satellite clinics will be a portal for emergency, specialty, and ongoing care, with physicians available across the footprint. So no matter where patients live, they can see the best provider for them. This landmark facility means more than online visits. It means remote monitoring for vital signs, emergent care everywhere without delay, and specialty care without the long drives. And it means world-class education, attracting, preparing, and retaining the next generation of virtual care providers. Sanford Health is connecting the Midwest, the country, and our world with one network, one family, sharing expertise to improve the human condition and reach millions more lives. Because whether you live in Sioux Falls or Stickney, in New Zealand or in Ghana, we all deserve world-class health care everywhere.
Geez, isn't that cool? So at the end there it said, thanks, Denny. So Denny Sanford is our largest benefactor at Sanford Health. He's given hundreds of millions of dollars to the organization, and his gifts have been transformative. And his gifts go to create things like this virtual care center that will impact all of us and have global touch points. And we're doing that in the Dakotas. Like, that's cool. Like, the facility is going to be in Sioux Falls, and it's going to reach out, and we're going to have these physicians that are able to reach places like Minto, North Dakota, and Crosby, like all these small towns, virtually. You got a farmer that lives 60 to 90 miles away from his nearest medical center or even local clinic, and he just needs a routine checkup. How can we prevent that traveling? How can we reach more people where they're at? And gifts like this are what make that happen. Another cool thing on the horizon is our Williston partnership. So we announced a while back that we are going to be expanding into Williston. We're going to start with our super clinic here and then eventually down the road, a full-on hospital. The community there has invited us to make an impact and increase and elevate the level of care served by that, to serve that population with, and that's going to have tremendous impacts. And whether it's the virtual care hospital, this super clinic with the hospital, whatever it might be, Sanford is truly, we strive to innovate, to increase the level of care that our patients receive. And the philanthropic touch point on that is tremendous. At Sanford Health, at the foundation, we raise dollars to make the impossible possible. And that's a really cool sphere to work in, because things like the virtual hospital, things like Williston, things like child life, exist and are supported and created because of the generosity of other people. And we just have the great privilege of inviting people to make those differences every day. All right, that's it. Now, how do you sit on this thing? Is it like a backrest? Or...
Yeah, it's a fainting couch.
Yeah? Okay.
Yeah. All right. Okay. The clicker worked for you.
There you go, batteries.
All right, so we have Ross who will be mic running. He's very tall, and the cup that the mic is in is very orange and big, so you should have no trouble spotting him. I'm going to get started with something you didn't cover, is how did you end up here? You talked a lot about what you do, not how you got this job, what drove you to this industry might not be the right way to put it, but how did you end up working at Sanford doing this important work?
Yeah, Jake, you can start.
Fine. So prior to my work in philanthropy, I worked in healthcare administration for the Good Samaritan Society, which is America's largest nonprofit Christian long-term care organization. And I had the privilege of working with so many fantastic families and residents. And when Sanford and Good Sam merged in the beginning of 2019, we were in Rapid City at the time, and these opportunities came up to get to Bismarck. And my wife and I, we have 2 small kids, and we've always wanted to get back to Bismarck. We got a lot of family in the area. I'm from Dickinson, she's from Mayville, north of Fargo, and we just wanted to be back in North Dakota. And this opportunity in philanthropy came up, and it kind of embodied my favorite aspects of healthcare administration was the people. Working with families, working with residents, without all the bureaucracy and red tape of government things, payment systems, it was just relationship building. And personally, my daughter, my 4-year-old, she had a NICU stint, and we almost lost her the day that she was born. And so I have a personal touch point with things like the services, although we weren't served with a service like Child Life at the time. Those NICU docs, those nurses had tremendous impacts and saved my daughter's life. And my sister, my older sister, she had breast cancer when she was 14. And full remission from that, and then she got ovarian cancer when she was 22. Full remission from that, married, has 2 kids, and she's rocking life. And so I have personal, deep connections with the work that philanthropy can have. And most patients don't know the touch point of philanthropy, and that's okay. The important aspect is that we, as a team, invite individuals to make impacts in areas that are needed so that those patients don't have to worry if services are going to be available in Bismarck, in Dickinson, in Minot, in Williston, or anywhere with the virtual care center. That's our job, to make healthcare possible everywhere. Sorry you had to follow that. You wanted this.
I don't quite have the motivational path as that.
Right on,
but,
indeed.
yeah. But with my career path, I was working in insurance. I knew I wanted to kind of switch up my career, and I really didn't know 100% what I was getting into. But I knew I liked working with people. I knew I liked having conversations and being face-to-face with people. So I saw it as a great fit, and since day one, I've loved every day.
He shares an office with me, so maybe not every day.
Not every
day. Maybe.
Yeah.
It's mostly good?
Yeah.
Mostly good. Or we have a question.
Been to the golf tournament. We played on Taylor Daniels' team. It is a fantastic tournament. You roll up and there's a big boy food truck. Enough said. But you're right. I mean, I played a bazillion golf tournaments, and this one is definitely very different and a great experience. So good job on your first tournament last year. I'm curious about the virtual hospital, and maybe this is more of a technical question on that side, but how do you take your vitals at home? I mean, I know there's like machines and stuff that people would get. Is that something that the foundation covers? I mean, as a hypochondriac, I would take my temperature or, your oxygen, but there's a point where those things maybe are like $20 and don't work. So how does that work? Like if you are that farmer that's 90 miles, can they buy that equipment, or can the foundation help them? And I'm just more curious for myself, probably.
Yeah, so we can't speak to like all the technical terms because we don't like deal with that and what's covered by insurance, what's not covered by insurance. But what I can tell you is that we invested and have technology that's the size of this cell phone that can do all these things like check your blood pressure, check your heart rate. It's obviously got cameras on it, so you can talk directly to your physician. And if it's a lot of basic care stuff, routine checkups. And if you need anything that is beyond that, you have to physically go to a clinic or go to a hospital, whatever that might be. From my understanding, Sarah, correct me if I'm wrong, we used to, or you still currently can, buy this at Best Buy. Not sure if you can still do that, but at one point we were selling the technology at Best Buy and people could pick it up. And it's like a subscription-based thing. Pay a subscription, they have the fee, internet connection. And with this initiative with the virtual care hospital, it's to bolster that method of care anywhere, care everywhere.
And I think just to add on to that, thanks. I need two hands. You hold. So just to add on to that too, these clinical hubs will be physical places where people can go in rural settings. One of the first ones we're looking at in the Bismarck region, which is really central and western North Dakota, is up in Newtown. And so we'll have a clinic there. There will be a nurse there. They'll be able then to digitally connect to the physician, but still have that hands-on care provider that's clinically trained who can help do that too.
Do you think that kind of technology is beneficial or detrimental to hypochondriacs?
I don't think I'm qualified to answer that.
That's one loaded question, by the way.
Big question.
Yeah.
I have a question for you two, that as we're watching the videos and we're seeing the impact of the money that you raise, although you're not on the ground in the hospitals, you are doing work that allows the people on the ground in the hospitals to save lives and to change lives. How do you prevent the emotional burnout that would come along with such a big responsibility? Or do you not? You're just so burned out.
I haven't hit a burnout yet, but you hear the impactful stories and the motivational stories. I think that helps continue to keep doing what you're doing each day. So I think it's those stories like, I forget her name now. Ellen stories like that make your work more meaningful and add impact each day.
Yeah, I mean, 90% of our work, I wouldn't say 99%, but 90% of our work is no's. We're identifying individuals and businesses across our footprint and determining if they have not everyone's philanthropic, here's the world. And the amount of people in the world that are philanthropic, that are willing to give of their treasure to something that helps other people is like this small. Then we're in America where the pool shrinks down to here, and then the pool shrinks to the amount of people that give to healthcare is down to there, because you got many worthy causes everywhere that are not healthcare related. Healthcare is a great one because it impacts everybody. Everybody needs healthcare, even if you don't need it today. If you get old, you're going to need healthcare. And so it touches everyone at some point in their life. And so it, wait, what was the original question? I was like rambling there.
How do you prevent burnout?
Yeah. So, I mean, I'm burnt out, I'm forgetting. No, but it's that 10% of donors that do give that really make the impact, that we can see where this happens. And we have teams. We have our Bismarck team, we have our Fargo team, we have our team in Bemidji and Sioux Falls, and we're all doing great work, and we all have different specific initiatives that are market specific, and it's all really impactful. And we have a great team, we're really collaborative, and we just work great together, and so that helps a lot. And things like programs like Child Life that rely 100% on our ability to raise funds and to sustain that program, there's pressure. And some of that's relieved with investments, and then the interest off of those investments pays for salaries. But nonetheless, if you want to grow a program, you can't grow it without philanthropic dollars. And so we have goals that we set and initiatives that we want to help with, and it's all determined based on what our leadership here in the Bismarck marketplace is wanting to do, and we just kind of come alongside that and tell them what we can do to make an impact.
Great. I see we have a question.
Yeah, thanks for presenting today. Question is, our medical community has gone through hell during the pandemic, and how can we support them besides just a big thank you, getting vaccinated, living a healthy lifestyle? What are some other ways?
Yeah, I missed the first part of that question. Can you?
That our medical community has been through hell through the pandemic, and it's not only patients, but now doctors and nurses that need our help.
Yeah, that's a great question. Thank you. We have an employee crisis fund that can be donated to by employees or community members that serves to assist our employees when they undergo a financial hardship at no fault of their own. So whether their house burns down, or a car accident, or medical bills, or they're not able to pay the utilities that month, this fund is there to help them when they're in need. So that's an excellent way that the community can kind of rally around our healthcare workers here in Bismarck.
And just to add on to that, that's a fantastic way to give and support healthcare workers, but really giving in any retrospect. If your passion is, maybe you have a personal touch point with cancer, you yourself had cancer, a parent, a loved one had cancer, supporting our cancer program is supporting the team members there that do that work every day, whether it's equipment purchases, fortifying a program that's taken off and we're trying to sustain it. All those avenues help. And so we can align through a conversation with folks like me or Devin or Sarah what your passion might be in a particular area that you have a personal tie with, and we can have a conversation about what those needs are and what impact you might want to have on those team members that work within that area.
So you mentioned a little bit ago that 90% of the answers that you get are no. So you must be really good at dealing with rejection. Were you always good at dealing with rejection? Have you gotten better at it? What advice do you have for people to get comfortable with it? Because when you're asking for money, most people are probably like, get out of my face.
Yeah, my wife would say that I'm pretty good at handling rejection now. But we're married, so eventually, I overcame that.
Wear them down is the advice.
Yeah, perseverance. Yeah, perseverance. No, not every. Can I start? Okay, yeah. Not everyone wants to give to healthcare, and that's okay. I think it's really important that if people are philanthropic, that they give to a local entity that they're passionate about. Maybe it's the food bank, maybe it's healthcare, maybe it's another initiative. But supporting in your local community is really important. This really gets into play when people are at the end of their life and they haven't made plans for what is going to happen to their assets at the end of their life, whether it's their homes, their investments, and then what ends up happening is their dollars, a lot more dollars than they probably wanted to go to pay taxes to the government. There's tax savings when you decide to give to charities, and we are big encouragers of giving to charity, and through conversations we can help folks maximize money so you can take care of your family and your kids and your grandkids, money that you can that you're legally obligated to give to the government, but then how do you reduce that and have more of it go to the charities that you're passionate about in your community. But that's all intentional work. That just doesn't happen when you die. You got to set it up. You got to plan for it.
I think for me, handling the no is you can't take it personally, especially when you start out as a fundraiser and you're not used to hearing no so much. It's easy to take it personally, and you think after a conversation or a meeting, after you hear a no, you can kind of look back and think, oh, did I say this wrong, or could I have said something better to make them give? But at the end of the day, we're simply just inviting people to give and giving them an avenue to give and support healthcare. And there's a million circumstances that can go on in people's lives that have them not be able to give at that time. Working with event sponsorships for myself, for a lot of companies going 2 years through the pandemic, not everyone did well. Some people did well, but for those companies that took a hit and they're not able to sponsor now, that they've been a sponsor of Gabber for 10 years, but after a tough year, they're not able to. So you can't always take it personally, and that there's a lot of things going on that can impact it.
So your advice is don't take it personally. Jake says wait for them to die.
Everyone dies.
Yeah, all right. We have another question.
You just alluded to Gabber. We had a chance to do it a couple of, probably 3 or 4 years ago. But I just thought for folks in here that might be thinking about that, you hear bike race and you think, oh, well, I'm not an athlete, blah, 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 blah. So if you could talk a little bit about, the mechanics of it and the spirit of it, because really anybody can.
Absolutely, yeah. So we have 2 different ways, or really 3 different ways now after COVID that you can participate. We have competitive teams, non-competitive teams, and then virtual participants. So if you're an avid biker like Jake, you can be on the competitive team, and The day of Gabber, so there's 12 participants on each team, so throughout the day there's 12 heats. So each participant will ride for 20 minutes, and then there's a 10-minute break for the next biker to get on the bike and then ride for an additional 20 minutes. But the day of, I have not got to really experience a full in-person Gabber yet, so I'm really excited. But from the videos and all of the stories I've heard, there's really nothing quite like it in our community. The excitement of everyone coming together I heard is unbelievable. And so I think after 2 years of not being together in person, I can see it being one of the best Gabbers yet.
And just supporting a team. If you're asked to, maybe you're not asked to be a writer, but maybe you're just asked to support a team. Gabber, the funds that come into that are the only funds that go out. So that's kind of another pressure point that that maybe could lead to a little bit of burnout. Is it, if we don't raise the funds, if teams don't rally, if those dollars aren't there, kids aren't impacted, at least maybe not in the ways that they need, or less kids are impacted because the dollars are finite, and it's kind of one of those year-by-year turnover cycles where funds in and funds out, and so it's pressures on to raise funds for those kids.
Great. We have another question. Evan?
Yeah, just out of curiosity, could you kind of describe maybe a typical, if that's possible, small, medium, and large donor?
Sure. So within our foundation, so Devin, he's the master of events, and then he also works with what's called mid-level giving, which that threshold is anywhere below $10,000. So donors that maybe give $1,000 maybe every year, they want to give $3,000. Devin is the master and steward of that group. And then I work with the major gift donors, which are $10,000 and above. So I work with folks who are, maybe they want to do a $10,000 over 2-year pledge, and they just want to pay $5,000 one year, $5,000 another year. There's a tax incentive to do so in North Dakota, all the way up to $1 million. I'm working with a donor right now with $1 million ask out there and plus. And so it's just, each conversation's basically the same. You know, it's a relationships that's developed. You have conversations about what the needs are in the medical center or any of our clinics or services across our footprint, and then you try to connect what the donor's interest is in healthcare, if there is one. First, identifying if they're interested in giving to healthcare. Usually, if they're willing to meet with you, they're at least interested. And so having a conversation about that, identifying what they're passionate about and aligning it with an initiative that we have going on, and then eventually inviting them to make a difference at a level that is impactful for them and the organization too. Some people can do $10,000, some people can do $100, some people can do $2,000, some people in companies can do $1 million plus. It's all beautiful, it's all meaningful. Again, the pool of people who are willing to give of their treasure at any amount is tiny. And so every dollar that is given philanthropically is extremely generous and beautiful.
We have another question.
Thanks, guys. Okay, I have a two-part. The first one is, I love to write thank yous, and I'm really trying to instill that in my kids. And watching that video, and like, it's a parent's worst nightmare, right, to have a sick kid. But I think about, as a parent too, how kids kind of process things and how we teach them as parents to be thankful, or this, you know, you're blessed because of this and that. Do you guys ever receive like thank you letters or pictures from kids that kind of can put into their own words, you know, how thankful they are to have received programs that you've helped create?
Yeah, I can speak to that. I know with the Great American Bike Race, this year we received a little handwritten letter from one of our Gabber kiddos from his grandma, thanking us for the event that we put on, and that the difference that it's made in her grandchild's life, that he wouldn't be able to have the life that he has if it wasn't for everyone coming together for Gabber. And so we get those letters in, and it makes the work that we do more meaningful. It makes each day coming into work easier. But we do get those letters, yeah.
Awesome. Second part, I know on Facebook I'll usually see like a friend or a friend of a friend that's participating in Gabber. But what if one of us don't see a friend participating? Is there a way like we can look up teams and find a way to donate before the race?
Yes. So we have a Gabber website. It's Gabber, G-A-B-R, .sanfordhealth.org. You can go on there. You can look at all the different teams, all the different participants. You can donate just to the event. You can donate to a team or a participant. You can join a team.
So if you wanted your business to sign up a team, how would that process go? Is it full? Are there spots?
We have spots open still, so I encourage everyone, if you are interested, to reach out to one of us.
1 million cups.
To
Great American Bike
that would
Race.
be great to see you guys there.
I
You
have
can.
an orange bike. Orange
Not
bike or
that
no
I'm-
go?
So people are allowed to decorate their space. I'm not sure if we can get a bike
So
orange, but we can get a lot of orange
battery
around.
themed.
Yeah.
Great.
Yeah.
But so is it on the website if we want to do a team or an organization?
Correct.
Just go sign up?
Yep, gabber.sanfordhealth.org. You can talk to one of us, give us a call.
And there's posters out there where the coffee is that has more information if you forget the website.
Great. Well, we are ready to ask our last question, and Ross is going to have the honors. If I can get to it, otherwise you can just make one up. Oh, there we go.
There it is.
All right, so Ross, would you ask these gentlemen our last question? And it's the same last question we always ask.
So our last question, first of all, thanks again, you guys, for doing your presentation. I appreciate both of you for being here for that. So the question is, what can we, the 1 Million Cups community, do to help your organization?
Yeah, I'll start. Awareness, participation, so whether it's, telling your friends about Gabber, signing up for a team yourself, donating, any way that you can help out, we ask you to or encourage you to. So that would be one way to help out.
On the major gift side, in western North Dakota, there's a lot of hidden wealth. People aren't boastful about their wealth, and a lot of it happens through relationships and through casual conversation, through Rotary clubs, through things like 1 Million Cups, where they hear about these initiatives, and whether it's on a global scale or whether it's on a Bismarck scale, whatever it might be, it's just a matter of connecting them to us, going back to that awareness. A lot of folks don't know that Sanford Health has a foundation, more or less needs a foundation, but healthcare margins are extremely slim. In philanthropic dollars, our margin is like 100%, so every dollar that comes in is given, and so it makes a huge impact. But those relationships and those one-on-one conversations usually happen through other people. They know someone who may have had an impact, a stay in, maybe at the medical center, they had a surgery, and they just had such a great experience, and they want to do something. Well, now you have seen Jake and Devin present about the Sanford Health Foundation. Even if you don't have our direct contact, you can reach out to these guys, because you know these guys, and then they can reach out to us. It's all about relationships and connection and awareness, and just connecting those pieces together so that someone who wants to make an impact has the opportunity and the invitation to do so.
Amazing. Thank you guys so very much for your time and your work. Let's give them a round of applause.
Thank you.
All right, and to get another sticker on your cup, you can come to these events. We have the business pitch challenge that is happening tonight. The contestants will be on stage next week, so you can heckle them 2 times in 7 days. And then the week after, we have Hexa Hive, which is strategy and marketing. So we'll see you that next week and the week after and the week after. If you know a person or an organization that you think would do a really good job up here, make sure that you tell them to submit an application on the website for our Bismarck Mandan 1 Million Cups. Bring a friend, bring your mom, bring your kids, bring your moms. Yeah, we have a mom here today. Hi. And let's give these gentlemen one more round of applause for their work.
Thank you.